Central stenosis can occur in the cervical spine as well. When it's more pronounced, you have a syndrome called cervical spondylitic myelopathy. When it gets to that stage, that means their motor tracts aren't functioning or their dorsal tracts in the spinal cord aren't functioning correctly. They're not. You got to be very, very gentle. They're not really a case for mechanical care in that point. But if it's not to that stage yet, you have cervical spinal stenosis. We just flexion traction the cervical spine as well. Okay, if you'd like to lie down on your back. This time the patient's head's going to be on my lap. Come back towards me a little more. Sit. And I just lean back with my body and apply traction. The exact position is dependent on what the patient feels is right. Funnily enough, most often, in my experience, that the patients would like a little flexion and they like to go to the left. I don't know why. But they'll find that magic spot and you just hold that. Now, the procedures before I told you pressure on, pressure off, pressure on, pressure off. Well, with the neck, I think you can hold it a little bit more sustained for a longer period of time. And again, the idea is the neural canals opened up, the volume increases, the holes get larger. So arterial blood can go in, venous blood can go out, lymph fluid can go out, maybe inflammatory edema can move. Mind you, most often in an inflammatory condition, we wouldn't treat them. Or we'd be very gentle when we treat them. How does that feel?
Good.
And then relax. If we're not sure about the position for them, we'll just move that around. More flexion. Or maybe to the other side. It would make sense that to open up the neural canal, the more flexion, the greater the volume in the neural canal. But I think when you increase the flexion in the cervical spine, there's some traction takes place in the spinal cord. So I think you have to kind of be very careful to what's just right for the patient. The results can be quite phenomenal, where that numbness in the arm will go away, or the pain in the shoulder will abate. But sometimes it takes a while. You may have to hold it for a minute or two or three. Quite often the patient gets that warming sensation during the procedure or after the procedure, and that's a good indicator. It's a good indicator that the blood's starting to flow into those nerves. Of course, if the blood flows into the nerves, then they can function, both their motor and sensory function improve.